Hello everyone. Welcome to an Introduction to Systemic Therapy, a presentation for patients and families. This video has been developed for you by the BC Cancer Patient Family Education and Experience Team in collaboration with pharmacy and nursing. BC Cancer has 6 regional cancer centers across the province. It is important for you to know that no matter where a person lives in BC, if they have a diagnosis of cancer, they will receive the same treatment anywhere in the province. During this presentation, we will review the general and specific side effects of systemic therapies, how to manage those side effects, what symptoms you need to report, and how to report those symptoms. If you are viewing this video at a BC Cancer Center, there will be time afterwards to answer your questions and provide you a tour of the center. There will be a team of healthcare providers available to you throughout your treatment and into your follow-up care phase. Each provider has their own unique role to play in supporting you during this time. Some of your team members will work directly with you to provide your treatment and address any care needs you may have. Other members are available to support you and your family with any physical and/or emotional impacts of a cancer diagnosis and treatment. During your cancer treatments, it is very important to stay closely connected to your family doctor so they can monitor your non-cancer health concerns. Your cancer care team includes you, oncologists, your family doctor or GP, patient and family counselors, nurses, pharmacists, dietitians, unit clerks, secretaries, and volunteers. There are also librarians available for your information needs. So what is cancer? Cancer is a disease that starts in the cells. Our bodies are made up of millions of cells, grouped together to form tissues, such as muscles, nerves, and bones, and organs such as the lungs and liver. Cells in the body normally grow, reproduce, and die. But sometimes the information gets mixed up, causing the cells to behave and grow abnormally. These abnormal cells can then develop into tumors, which can spread to other parts of the body. Different types of cancers vary in their signs and symptoms, how fast they grow, and how they respond to different treatments. There are 4 ways cancer can be treated: with surgery, radiation, systemic therapy, and smoking cessation. Smoking cessation is a part of cancer treatment. So if you use recreational tobacco, we recommend stopping smoking. This does not include ceremonial tobacco used by Indigenous groups. The Surgeon General's report on smoking states that stopping smoking at the time of a cancer diagnosis could lower the risk of death by up to 40%. For some patients, the benefits of quitting smoking have been shown to be equal to or even exceed the value of some of the latest cancer therapies. In addition, smoking is associated with increased infection rates, lung complications, impaired wound healing following surgery for cancer, and longer hospital stays. Stopping smoking can help your other cancer treatments work better, lower your chance of complications and side effects, and for side effects that you do experience, they may be less severe. Overall, quitting smoking will improve your quality of life, helping you to live better. There are lots of resources available to support you in stopping smoking, including free nicotine replacement therapies like the patch or gum, which you can get from any pharmacy without a prescription. Just talk to your pharmacist. Quit Now is a provincial phone line that provides you direct support in making a quit plan and seeing it through. If you live in the Lower Mainland, you can ask for an appointment at the Vancouver General Hospital Smoking Cessation Clinic. The First Nations Health Authority has resources and supports for patients with Indigenous heritage. And of course, any oncology nurse at BC Cancer can further discuss the benefits of quitting smoking and tobacco use and refer you to the Quit Now program. We are here to help. So what is systemic therapy? Systemic therapy is the treatment of cancer with a drug or medication that travels throughout the body via the bloodstream. This can affect both cancer cells and normal cells. For some cancers, only one drug is needed to effectively treat the cancer cells. For others, a combination of several drugs are needed. In addition, a person's cancer treatment plan may include a combination of treatments, such as radiation therapy at the same time as systemic therapy treatment. There are many different systemic therapy drugs that are used to treat cancer. They work in different ways and are sometimes called different names. You may have heard some of these words already to describe your treatment. Chemotherapy, also known as chemo, are drugs that destroy cells, both normal and cancer cells. There are over 100 different types of chemotherapy drugs. Sometimes they are called cytotoxic because they kill cells. Hormone therapies are drugs that change specific hormones to stop or slow cancer growth. Immunotherapies are drugs that activate your own immune system to find and destroy cancer cells. Targeted therapies are drugs that target specific molecules that stop cancer cells from growing and spreading. All of these are systemic therapies. The goals of systemic therapy treatment can be to eliminate the cancer, shrink the tumor, prevent cancer from spreading, or relieve symptoms from cancer, such as pain. Drugs can be administered either by intravenous or IV, pill, injection, or through an IV infusion pump. If you are to receive your therapy using the IV or injection methods, you will be given an appointment date. The time of your appointment will be confirmed closer to that date. At the time of your appointment, a registered nurse will give your treatment and review your treatment plan and potential side effects. IV treatments can take several minutes to several hours, up to a full day sometimes, depending on the protocol. Some patients go home with a continuous chemotherapy IV infusion pump. If your therapy is to be given in the form of pills, you will be provided with an appointment to meet with the pharmacist. They will give you your prescription, review the side effects of your treatment, and reinforce who and when to call for medical advice. There is a long list of possible side effects. No one experiences all of these side effects, and not all drugs will cause these side effects. This information is not meant to scare you, but to prepare you if you do experience side effects. Your nurse or pharmacist will discuss the specific side effects related to your particular drugs at the time of your appointment. We know some side effects can be prevented. For example, we know some drugs can cause nausea and vomiting, so we prescribe anti-nausea drugs to prevent nausea and vomiting from happening. This video will cover the most common side effects of systemic therapy, shown here. Your nurse or pharmacist will review the side effects related to your specific treatment, including the detailed written information in your new patient package at your first appointment. If you experience any of these side effects, please contact your healthcare provider using the phone numbers provided to you. For some side effects, you might find it helpful to write them down and bring them to your next appointment to discuss with your doctor or nurse. The Chemotherapy and Other Drug Therapies, A Guide for People with Cancer booklet offers information about treatment and tips on managing side effects. If you have not yet received one, be sure to ask for one at your next appointment. Bone marrow suppression is the first side effect I will review. You may hear your nurse, doctor, or pharmacist discussing your blood counts. They are referring to the different types of blood cells in your bloodstream, including your white blood cells, red blood cells, and platelets. Each blood cell has a different function in the body. Red blood cells carry oxygen to your body's cells, white blood cells fight infection, and platelets form blood clots or scabs. These blood cells may decrease in number following systemic therapy, but they are expected to return to normal before the next treatment. Prior to each treatment, and sometimes in the middle of your treatment cycle, you will have a blood test to check the level of your blood cells. The results of blood tests will determine whether your blood cells have recovered enough and whether it is safe to proceed with your treatment. If your blood cells are not fully recovered, your oncologist may still proceed with treatment. However, they may reduce your dose. It is not unusual for your treatment to be delayed up to a week if your blood cells are too low. So let's break it down some more, starting with the white blood cells. There are several types of white blood cells in our circulation, but the main cells that fight infection are called the neutrophils. White blood cells are affected by some cancer drugs and may be decreased following your treatment. This is called neutropenia. Your neutrophils will begin recovering prior to your next treatment. When the neutrophil count is low, your body is less able to fight an infection on its own, so you will need to watch for signs of infection. If you do develop any signs or symptoms, you need to call the cancer center immediately. So what are the signs and symptoms to watch for? The signs and symptoms of infection to watch for are fever, flu-like symptoms such as body aches, feeling warm, chilled, or shaky, a sore throat and/or mouth, cough and/or shortness of breath, burning when urinating or urinating more often, areas of redness or tenderness, loose or liquid stools, or severe dizziness. If you have any of these signs of infection, then check your temperature. Always report all signs and symptoms. A temperature of 38 degrees or higher is a serious medical emergency. Fever is a sign of infection, even if you don't have any other signs. Fever is serious when your white blood cells are low. Do not take drugs for a fever, such as Tylenol, unless directed to do so by your cancer care team. Day or night, you must report a fever immediately using the numbers and processes in your new patient package. This information will be reviewed again at your first treatment appointment. The best way to prevent infections is to wash your hands. Wash your hands before eating and preparing food, and after using the bathroom or sneezing. You can use a waterless cleaner if you do not have access to soap and water. Wash all fresh fruits and vegetables thoroughly. When others in your household are sick, have them wash their hands more often to prevent the transmission of germs. Once you learn which days your blood cells may be low, then you may want to be more careful by avoiding people with obvious colds or staying away from large crowds in confined areas. Avoid children who have the chicken pox or measles, or adults who have the shingles. The flu vaccine is recommended during flu season. However, please talk with your oncologist before getting a vaccination. Wash your hands. Good oral care is also essential. Brush your teeth with a soft toothbrush after eating and before bedtime. And consult your nurse prior to a dental appointment. Avoid handling pet feces, including fish tanks. Avoid skin cuts and nicks. Water-soluble lubricant and a condom should be used during intercourse. And most importantly, wash your hands. So, should you come into the clinic if you think you have an infection? Call the Cancer Center first. Call us if you have an infection such as the flu, or if you have been exposed to an infectious illness such as chickenpox or shingles. Friends and families with infections should stay at home until they have recovered. This is for your safety and the safety of the other cancer patients. If at any time you are unsure, please call one of the clinic nurses to check that it is safe to come to the clinic. The next type of blood cells are platelet cells, the ones responsible for making clots. Your platelets may be lowered for a short time after your systemic therapy treatment. This is called thrombocytopenia. If this happens, your ability to form a clot will be lowered. It is important to recognize the signs and symptoms of low platelets. So what are some signs of low platelets? Signs and symptoms of low platelets are a cut that won't stop bleeding, bruises on your body, bleeding from the nose and gums, a red pinpoint rash, black tarry stools, blood in your urine. Report any of these signs and symptoms. If you do develop low platelets, there are things that you can do to help manage, such as using a soft toothbrush and continuing your regular oral hygiene. Just take caution with flossing. Blow your nose gently and avoid ibuprofen and aspirin unless it's ordered by your doctor. Also avoid high-risk activities such as filleting a salmon or mountain biking. In general, just be careful. The last type of blood cell we will review are red blood cells, which are responsible for carrying oxygen to the body's cells. These may also be lowered for a short time after your systemic therapy treatment. This is called anemia, and your energy level will be affected. It is important to recognize the signs and symptoms of low red cells. So what are some signs of low red cells? Signs and symptoms of low red cells include low energy or feeling fatigued, shortness of breath, a pale appearance, or chest tightness or chest pain. Go to the nearest emergency immediately if you experience chest tightness or chest pain. Report any other signs or symptoms of low red cells. Fatigue is the most common symptom during and after cancer treatments. Fatigue is a feeling of weariness, tiredness, or lack of energy that does not improve with rest. It usually occurs in the first week after treatment, and as the number of treatment cycles increases, fatigue may get worse or last longer. The fatigue experienced by a cancer person is different from fatigue of everyday life. Cancer treatment-related fatigue can appear suddenly, be overwhelming, and is not always relieved by rest. It can last after treatment ends and may affect your mood or emotions. It may also affect your ability to do usual activities and can make it hard to concentrate. Talk to your nurse about what can be done to preserve quality in your life. Some tips to help you manage fatigue include doing regular light exercise, balance physical and social activities with rest, and listen to your body. Rest when you need it. Stick to a regular sleeping pattern and eat a well-balanced diet that includes plenty of fluids. Also, allow your friends and family to help you. Patients on systemic therapy are at risk for developing blood clots, which are semi-solid clumps of blood that can cause serious complications. Signs and symptoms of a blood clot include sudden severe shortness of breath, swelling of one leg, or painful blue fingers or toes. Uncommon signs and symptoms of a blood clot could be those that indicate a heart attack or stroke, such as sudden confusion, trouble speaking or trouble seeing, sudden numbness or weakness in the face, arm, or leg, or chest tightness or chest pain. If you experience any of these symptoms, go to the nearest emergency room immediately. Nausea and vomiting. Nausea is an unpleasant, queasy feeling or feeling sick to your stomach. Vomiting is throwing up. Not all people will experience nausea and vomiting. Your physician will prescribe anti-nausea drugs to help prevent nausea and vomiting. This prescription needs to be filled at your community pharmacy, and we ask that you bring the pills with you to your first appointment. These prescriptions can be costly, so let your doctor or nurse know if you need help financially. If you need more information or assistance, contact the Patient and Family Counseling Program. You can help manage nausea and vomiting by staying well hydrated. Drink 8 cups of fluid each day. Eat small, frequent, light meals, especially on your treatment day, and keep your mouth clean. Brush at least twice a day. Avoid things like hot, spicy, or greasy foods, heavy meals right after your treatment, or strong odors. The resource Food Choices to Help Control Nausea is available from your cancer care team. Constipation is when you're not having bowel movements as often as you used to. This can be caused by some cancer drugs, some anti-nausea drugs, most pain medications, reduced fluid or fiber intake, stress, or lack of exercise. The resource Food Choices to Help Manage Constipation is also available to you through your cancer care team. It is normal to have a bowel movement at least every 2 to 3 days, even when little food is eaten. To help prevent constipation, you should increase your fluid intake to 8 glasses a day. Try warm fluids and increase your fiber intake. Be as physically active as possible. If you have not had a bowel movement in 3 days, please talk to your cancer care team. Diarrhea is when your bowel movements are more frequent or more watery than normal. This may be associated with urgency, cramping, and bloating, and can be serious if it's not managed. There are many reasons why you might experience diarrhea. Some possible causes include cancer therapy drugs, antibiotics, bowel surgery, or radiation to the pelvis. There are different ways to manage diarrhea based on which drugs you receive. Some general ways to manage it include eating small and frequent meals and choosing foods with less fiber. You should also avoid foods that may aggravate diarrhea, such as spicy or greasy foods. Some of you may have been prescribed anti-diarrhea drugs by your doctor to treat diarrhea. You may take them as you have been instructed to do so. Other people will need a very different treatment for their diarrhea, as it has the potential to be more serious. When you have your first treatment, the nurse who teaches you about side effects related to your specific drugs will review exactly how to manage diarrhea and when to report this to your cancer care team. Untreated diarrhea can lead to dehydration, which can be serious if it's not prevented or managed. Remember to drink 8 to 10 glasses of fluid each day and use anti-diarrhea drugs if they have been prescribed for you. as instructed by your healthcare team. When you feel better, be sure to eat foods high in calories and protein. If you experience diarrhea that lasts more than 24 hours, contact your cancer care team. Signs and symptoms of dehydration include fatigue, extreme thirst, nausea, dry mouth, or low urine output or dark-colored urine. Be sure to report these signs and symptoms to your cancer care team. Some drugs can cause mouth sores that may occur a few days after your treatment. Mouth sores can occur on the tongue, gums, the sides of the mouth, the lips, and in the throat. They can be painful and could lead to difficulty eating and swallowing. It is important to watch for and report any signs or symptoms of mouth sores or bleeding gums, as they can lead to an infection. To help prevent and manage mouth sores, you need to inspect your mouth regularly and practice good oral hygiene. Rinse your mouth 3 to 4 times a day using a baking soda in warm water solution. And use a soft toothbrush and avoid any mouthwash with alcohol. If you wear dentures, make sure they fit well. And avoid extremes of hot or cold and spicy foods. The resource Food Choices to Try with Mouth Sores is available from your cancer care team. The skin is your body's first line of defense against bacteria. You may experience skin changes as a result of your treatment. Signs and symptoms of skin changes could be redness, rash or acne, itching, peeling, or dryness. When you have your first treatment, the nurse who teaches you about side effects related to your specific drugs will review exactly how to manage skin changes and when to report this to your healthcare provider. Some general tips are to wash your skin often using warm water with gentle soap. Moisturize your skin. Just make sure to choose alcohol and fragrance-free products. Lanolin-based lip balms and creams are good choices. Be sure to protect against sun exposure with clothing, sunscreen with SPF 30, and protective eyewear such as sunglasses and hats. Be sure to use an electric razor when shaving. Hair loss is a side effect of some systemic therapies, but not all drugs cause hair loss. Some drugs, but not all, may cause your hair color to change. It is important to note that if hair loss does happen, it is temporary. We suggest not cutting your hair until after your first appointment, so your nurse can confirm if this will be an expected side effect of your specific treatment. When your hair does begin to grow back about 3 to 4 weeks after your final treatment, it may be a different texture or color. There are several resources available to support you if hair loss will be an expected side effect of your treatment. Your oncologist can write you a prescription for a wig. Prior to losing your hair, you may want to visit a wig shop to match your hair color. Gently used donated wigs are available through the Canadian Cancer Society. Please call for the nearest location. You can also register at your cancer center for the Look Good, Feel Better program. Some patients may experience changes to their senses as a result of treatment. You may see side effects related to touch, sound, taste, smell, or sight. With taste changes, foods may not taste the same. Patients often describe a metallic or cardboard taste. This can affect your appetite. The use of sweet and salty flavorings can help. There are resources available to help you cope with taste changes during treatment. As with hair loss, changes to taste are temporary and will return to normal at the end of your treatment. Changes in your memory and concentration can be very subtle, or they can be quite bothersome. These changes may be caused by treatment, fatigue, stress, or insomnia. Some strategies to help you manage include planning your activities, making lists, and asking for help from family and friends. These side effects may disappear after your treatment is completed. If you're concerned about these changes, please contact the Patient and Family Counseling Department to speak with a counselor. Some treatments may cause changes to your hormonal system. Some men may have a decrease in sperm count, so sperm banking may be appropriate prior to starting treatment. If you're unsure, talk with your doctor. Birth control is very important for both men and women. Pregnancy must be avoided while on treatment. If you need guidance with concerns about intimacy in your relationships, contact the Patient and Family Counseling Program. Now that we have gone over some of the common side effects of treatment, let's review some tips for treatment day. The length of treatments can vary, so be sure to wear comfortable clothing with sleeves that are easy to roll up to help us start your IV or take your blood pressure. All BC Cancer Centers are fragrance-free, so please do not wear perfumes or colognes for those with sensitivities to smell. This also applies to support people coming with you to your appointments. Be sure to eat a light meal before and after treatment, and take your regular medications as prescribed. Please arrange a ride to and from your appointment. Volunteer drivers are available, and the contact information will be in your new patient package. Pay parking is available for patients and visitors at each of the cancer centers. Please remember to bring money for the parking meter if you plan to park on site. Feel free to bring snacks and drinks, just no strong odors, please. And a support person is welcome, but we ask that you only have one visitor with you at a time. Please note that the treatment room is not an appropriate place for small children. Bring along your magazines, books, or music with headphones, your new patient package, and of course, any and all questions you may have. If you have been prescribed anti-nausea pills by your oncologist, please remember to have them filled at your community pharmacy. Bring your anti-nausea pills with you on the day of treatment and take them as directed by your nurse. You may have noticed that I have mentioned several times to drink plenty of fluids. This is because water and fluids are vital to your health. It is important to stay well hydrated to prevent some of the potential side effects and symptoms, including nausea, dry mouth, diarrhea or constipation, fatigue, and dry skin. It will also be easier to start your IV if you're well hydrated. One of the common questions asked is if it is safe to use natural health products at the same time as systemic therapy. Currently, BC Cancer does not recommend the use of natural health products during cancer treatment. If you are currently taking any natural health products, please inform your oncologist or nurse. A pharmacist is available to counsel and answer questions you may have about the use of natural health products. There are safety precautions you need to be aware of when on systemic therapy. Keep all drugs out of reach of children, and it takes approximately 48 hours for your body to filter the drugs out. During that time, all of your body fluids, such as urine, vomit, or semen, carry small amounts of drug waste. Exposure to this drug waste can irritate your skin and be harmful to others and pets. You will be provided with the resource Guidelines for Handling Cancer Drugs and Body Fluids in the Home at your first treatment appointment. Other general safety precautions include flushing the toilet with the lid down to prevent any splashing, and if treatment drugs or body waste do splash on your skin, wash the area with soap and water. And use a condom during intercourse. Remember, pregnancy and breastfeeding should be avoided. So when should you call the Cancer Center? Call us immediately if you develop a sustained fever of 38 degrees Celsius, mouth sores that make it difficult to eat a soft diet or drink fluids, or diarrhea and you have not been given anti-diarrhea drugs, or you experience 6 or more loose stools in a 24-hour period. Also call us immediately if you have not had a bowel movement in 3 days, experience vomiting lasting for more than 24 hours, have nausea that lasts for more than a few days, feel lightheaded or dizzy, or if you develop abnormal bleeding or bruising, such as a nosebleed. After you return home, if you notice pain, redness, or swelling in the area where the drug was given through the IV, or if you're just unsure, please call. If it is during normal clinic hours, please call the telephone nursing line. After clinic hours, please call the doctor on call. Both of these numbers will be in your new patient package and will be reviewed with you at your first treatment appointment. Our pharmacists are an excellent resource and have a wealth of information about systemic therapy drugs. If you will be receiving your treatment in the form of pills, you will be given an appointment to speak with a pharmacist about your cancer drug prescriptions, including treatment side effects, herbal information, and drug interactions. They are very happy to discuss any questions about your prescriptions or natural health products. To ensure that you are receiving the correct drug and information, each time you pick up a cancer drug prescription from a BC Cancer pharmacy, you will be asked to provide 2 identifiers, such as your date of birth and address. One of the identifiers must be a primary piece of identification, or 2 secondary pieces of identification. Primary identification can be a driver's license, passport, or provincial identity card. Secondary identification can be a BC Cancer ID card, care card issued by the province of BC, or birth certificate. This is not a full list of documents that can be used for your ID. Speak to your nurse or pharmacist if you have any questions about your identification cards. If you are sending someone else to pick up your drug, he or she will be asked for a signed letter indicating your permission, or 2 pieces of your identification. Patient and family counseling services are available at each of the cancer centers. Support and counseling are a vital part of coping during cancer treatment. These services are available to individuals, couples, and families. Our patient and family counseling department can connect you with support groups and programs, as well as provide information and referral to community services. They can also provide assistance and information about practical and financial concerns. Oncology dietitians are also available at each cancer center. Ask your nurse or doctor for a referral if you would like to speak with one. They are able to support you if you experience difficulty eating, drinking, swallowing, or maintaining your weight. The resource Eating Well When You Have Cancer is also available upon request. Cancer and its treatments can affect voice, swallowing, speech, language, and quality of life. Speech-language pathologists can help you manage any communication and swallowing issues you may experience. Patients with head and neck cancer may benefit from doing swallowing exercises before beginning treatment. It is important to note that these side effects are most common for patients with head and neck cancers, but they may also occur with other types of cancer. If you experience difficulty swallowing pills or have concerns related to your speech or swallowing, ask your nurse or doctor for a referral. There is also more information on speech-language pathology on the BC Cancer website. For further information needs, there are library services available at each cancer center. Our librarians can assist you with finding the right resources to fit your needs. This includes books, pamphlets, audio and videotapes on a variety of topics such as cancer treatment, coping with cancer, caregiving, healing, relaxation, sexuality, and other topics of interest. Thank you very much for taking the time to view this introduction to systemic therapy. If you have any questions, write them down and bring them with you to your first appointment. We have covered a lot in this video, and it can be overwhelming. Just remember that your nurse will be going over your treatment plan and expected side effects at your first appointment. You also have a large cancer care team here to support you, so please let us know if you have any questions at any time.